Hi, Mrs. Espinoza. My name's Melissa. I'm your nurse today.
Hi,
How are you
dear.
feeling? Hi.
Oh, I'm okay.
Can you verify your name and date of birth for me?
Frederica Espinoza, 12345.
Perfect. And Mrs. Espinoza, do you have any allergies?
I do.
You do? What allergies do you have?
I'm allergic to penicillin.
To penicillin, okay. And do you have any allergies for latex, shellfish, iodine?
Oh no, I love me some shrimp.
You love you some shrimp.
I
Okay,
do.
Perfect. So I have a new order from your doctor, from Dr. Haldol.
Okay.
You know how we've tried the other, we tried the condom catheter, the straight cath, the toileting and everything else.
Yeah.
And we're still having that little bit of problem with the urinary retention in your bladder. So the doctor's ordered for an indwelling Foley catheter.
Okay.
Okay, and have you ever had a catheter before?
Is it the same as a straight cath?
It is similar. It just doesn't, with the straight cath, it goes in and back out. With the indwelling Foley, it's going to stay.
Okay.
Okay, are you okay with that?
Yeah, I'm okay.
Okay, perfect. So I'm going to go gather all my supplies and grab an assistant.
Okay.
Okay, so I'll be back shortly.
All right.
Yeah. Is there any way that I can get your assistance?
Absolutely.
Perfect. I got all the supplies. The only thing is, the lighting's really, really good.
Okay.
So I don't think we're going to need a flashlight.
Oh, okay.
But if
That'll
I can
work.
get your help, that would be amazing.
Absolutely.
Perfect.
Let me put my file down here.
Okay, Miss Shauna, you ready?
Absolutely.
Okay, perfect. Hi, Miss Espinoza.
Hi.
So my name's Melissa, as you know, I'm your nurse. This is my fellow employee, Shauna. She's going to help me put your Foley in today.
Okay.
Okay. Can you verify your name and date of birth, please?
Frederica Espinoza, 12345.
Perfect. And allergies for just the penicillin, correct?
Just the penicillin. Yes.
Okay, perfect.
There you go. The overhead table is clean for you.
Thank you very much. I'll wait till it dries before I set down our supplies. So what I'm going to do is I'm going to pull your curtain for privacy.
Okay.
Okay, perfect. So the very first thing we're going to do is we're going to get you nice and clean prior. Okay?
Okay.
Okay. So I'm going to bring your bed up from the floor. So that Miss Shauna and I are not killing our backs doing this.
Yeah, we don't want that.
No. We're going to take the flannel bath blanket here and we're going to put it over so you don't stay cold since we have to uncover you.
Okay.
Okay, assistant, can you help me lift her bottom, please?
Absolutely.
Miss Shauna, can I get the washcloth and the terry wash, please?
Absolutely.
Thank you very much. Okay, Miss Espinoza, we're going to pull your gown up, okay?
Okay.
Okay. So, Miss Espinoza, we're going to go ahead and get you clean.
Okay.
All sides of the washcloth wet, either with terry wash or soap and water. If you're using soap and water, you will need a separate rinse. Clean side, spread the labia, distal side first, top to bottom. Another clean side, proximal side, same thing, top to bottom. Third clean, straight down the middle. Fourth clean, the other portion of the pubis. Okay, so peri-care has now been completed. We're going to cover our patient for privacy while I switch gloves and do a 3-minute hand wash scrub. Simulating our 3-minute hand wash scrub prior to doing sterile technique. Okay, Ms. Espinosa, we're going to go ahead and get you ready and starting to do the Foley catheter.
Okay.
Now I'm going to set up my sterile field. Here in the middle of the bed, we're going to open the sterile field away from us first, and then each side, and lastly towards us. We're not going to cross over our sterile fields to keep it sterile. The only thing that is not sterile is 1 inch around the side. Next, I'm going to open my sterile gloves. Carefully, not to cross over sterile fields. I'm going to keep my eyes on my current sterile field that I have. Sometimes, most of the time, there will be a pair of sterile gloves inside the kit. Once you've opened it, to get those out, you're going to reach over, pinch the top of the package, bring it out, and then lay it down to open. I'm going to open my sterile gloves. Open that way. Each side that you're doing bottom and top, you want to fold back to help uncrease them so it will stay open. Same with the top. I'm going to pull just the little 1 inch area and open, crease out. So 1 inch around is fine to touch. The inside is sterile. Now I'm going to put my sterile gloves on. Carefully reach with the cuff. You're going to slide in, not touching the actual glove portion, except on the inside. Leave the first one like that. Now I'm going to take my sterile hand. I'm going to reach under the cuff, not touching the top portion, so that my fingers are in. Going to tuck my thumb, because if you don't tuck your thumb, you're more likely to touch a non-sterile portion with your sterile finger. Gently slide. Twisting can help. These can be difficult to get on. All the while I am keeping my sterile glove inside the cuff so it's sterile. Now I'm going to reach underneath this cuff, not touching the top, so pull that down. Yeah. Okay. So in real practice, it would be better to take off the watch. If you are not taking your watch off, then it needs to be covered, keeping everything sterile. So I am now sterile, therefore I cannot touch anything that is not sterile. If I do, at that point, that hand is not sterile anymore. I'm also going to keep anything sterile the waist and up. My assistant, she's in a clean situation, so she cannot touch anything sterile. If she touches anything sterile, it is at that point non-sterile, and we would need to start over. Okay, now I'm going to create my sterile field to work with. I'm going to take my top sheet here. One side is shiny, one side is dull. Shiny side goes down. Best way, you're going to grab it, thumbs on the shiny side, fingers inside, you're going to cover. This is going to help prevent you from making a mistake and touching the person, which would in fact make your sterile field no longer sterile. If you can, if the patient can lift themselves, perfect. If not, have an assistant help. We're going to place it without touching, and you remove your hands back. I have my bottom portion that is sterile. I'm going to create my sterile on top. You're going to take your other piece, has the hole. We're going to place, drop, and move. Now I have my sterile field to work to place my Foley. Okay, so in real life, in your kit, you have your iodine solution, which you would open and place on your cotton balls, which you would use this to hold them to re-clean and sterilize as best as possible the perineal area of your patient. For this, because we do not want to stain the mannequins, we are going to be using alcohol swab sticks. So it is fine that my assistant is helping me with this. She is allowed, even though she is only clean, to open the package as long as she is not reaching in and handing them to me. It is okay if she's on that side and I am reaching over, because I am sterile to the tops of my gloves, so I'm not contaminating my sterile field. Better practice would actually be for us to be up here where she would open it. She would push them up so I can reach. I will pull one out without touching the package, and then come back to my sterile fields to start the cleaning process with the alcohol. Or the other option, if you don't want to do one at a time, I could grab all three without touching the package. So I have all three. I can then bring it over to my sterile fields and lay it into my sterile field. Okay. So the first thing I'm going to do, because I do not want to touch my patient, the minute I touch, it is a point of no return. I cannot move my hand off that patient. It's just a better way to make sure that your sterile field is staying sterile. So I'm going to prep everything. I'm going to remove my inner tray. I can still touch because all of this is still sterile. So I'm going to move the bottom portion over, staying within my sterile fields, which is anything that is within it that is not 1 inch around. I'm then going to place my tray on the inside of my sterile fields. I am going to get my catheter and my bag ready. Inside your kit, you will have your saline. I'm going to uncap. I'm going to join my saline for my balloon onto the end. Assistant, can I get you to get the bag, please? Thank you. I am going to uncover my catheter, making sure it doesn't flop. Inside your kit, there may be a syringe full of the petroleum jelly. It may have packets. There are several ways that you can do this. You can either open the bottom of it here and stick your catheter in. You can push this into your tray and use it. If there's package, same thing. You can open it, place the catheter tip into it, or put it into your tray and lay it in there. Another option that you can do is you just grab your catheter portion. You can leave the bag in the box. It's fine. You don't have to move it off the side of the bed. Waste. You can take your lubrication, pull out your stopper, make sure it's not flopping. Now this is still sterile, so you can put it right back in your box, or if you have a garbage can near you, which you should, drop it, but keeping your hands above your waist. You can then take the tip of your catheter, insert it into your lubrication gel, and set that down so it's not going to flip-flop everywhere else, and that is still sterile. Okay? And then at this point, you can either do it prior to putting the catheter into the lubrication or after. On your catheter, it's going to tell you what the balloon is supposed to be inflated to. This one does say 10 milliliters. Some may be 5, it's going to vary. But make sure that you are not only checking on your packaging, but especially on the catheter, what it states. I am getting ready to prepare my patient for insertion of the Foley catheter. This hand, the minute I touch my patient, is then dirty. I am not to move it. Otherwise I will break sterile fields. So I'm going to spread the labia like I did during perineal care. This hand is not to move. I'm then going to take my other hand, which is clean, not clean, sterile. I'm going to grab my first swab. I'm going to go distal side first, top to bottom. I'm going to bring it towards me and around my sterile fields and into the garbage. I will not be doing the cleaning, distal top to bottom, bringing it over my sterile fields and dropping it. So, clean, out, garbage. My second one, proximal side, top, bottom, out, garbage. My third, top to bottom in the middle, out, garbage. So this hand has not moved. It will not move, otherwise I will break sterile fields. With my still sterile hand, I am going to get my catheter and I am ready for placement. My assistant's going to help me with holding the legs or holding the flashlight if it's needed for more light. I'm going to have the patient, Miss Espinoza, I'm going to have you take a nice deep breath in. And as she is exhaling, I am going to insert my catheter. Go ahead and breathe out. Perfect. Having them breathe in and out and forwarding the catheter when they're breathing out actually helps because the sphincters are being relaxed. I am going to insert the catheter until I see urine. Then I will advance it 1 to 2 inches more. Once again, this hand is still sterile. I have not touched my patient. And I'm going to inflate the balloon to the correct amount. So at this point, my sterile field, I've completed my process of inserting the Foley catheter. So now I am able to, if need be, collect a specimen. The specimen can be taken from the bag. You want to be careful that when you are opening and taking your specimen, that you are not touching the inner portion of your lid. The inner portion or the part where the cap connects to anything. You would carefully unhook from the bag, place it over, not touching, unclamp, okay. Fill my specimen, reclamp, connect back up. Then I am able to close my specimen. I would label this with the patient's name, their date of birth, their medical record number, as well as my initials, the date, and the time of collection before sending it to the lab. So one of our last steps is to hang our catheter bag. You will hang it on the side of the bed on a non-movable portion. So usually your bed frame. Do not put it on your bed rails or any part that can be moved. It's time to place our stat lock. You will open your package. Inside of the package, you will have a couple different items. You're going to have your stat lock, which is what this is, as well as some of your skin protectant prep. This is going to help keep this stuck on your patient. So what I'm going to do is I'm going to figure out the best place. You want that on their upper thigh. You want to make sure that there is some slack so it's not pulling on the catheter from your patient. So I'm going to place my stat lock right about here. I'm going to open up my skin protectant pads, kind of similar to your alcohol. I am going to cleanse the area with this. Circular motions, always the best. In to out. Then I'm going to, on my stat lock here, I'm also going to put my initials, date, time, as well as size of catheter and the amount that is in the balloon before I put it on the patient. Don't write on your patient. You're going to take off, have my stat lock. I have written the information on. I've prepped my patient's skin. Now, before I even put this onto the patient, I am going to attach it to the catheter. Remember, it goes on this portion of the catheter, not down here, not up higher. It is at this junction that it connects to. It's placed like that. Close, snap. Now it's attached. I'm going to leave space. I'm going to pull the paper off on the area that is skin prepped. Smooth it on. Make sure there's no wrinkles. And there, my catheter has been placed. There is still some loose slack, so it's not going to pull out of the patient. I am going to clean my patient again. Same process as before, peri-wash, soap and water, and a rinse, either one. Soak your washcloth in it. Clean side, same thing. You're going to be careful each side, clean new spot. Just be very careful when you're going down the middle because you don't want to pull on that catheter. Sometimes it's better to hold just the tip of the catheter and from the top down the catheter tubing. Make sure there's no lubrication, anything that's on your patient. You want them nice and clean. The final step to this process is clearing your sterile field, which is not sterile anymore. And it would be to, my sterile field is now gone. Last part is to take off your bath blanket. Bring their gown down. Cover your patient back up. Make sure that you have dropped your bed all the way down. Make sure their call light is within reach. See if they need anything else before you leave. Ms. Shauna, thank you so much for your help.
You're welcome.
With getting that in.
Absolutely.
I think it really helped the patient. There was 2 of us. We were able to talk her through it. You made my job definitely easier.
Well, I'm glad I could help.
Yes.
Now, I know that we have to document, but I can't remember what all we need to document. Can you tell me?
Yeah, so for documentation, we're going to document what type of Foley catheter we placed,
Okay.
the amount that we put into the balloon to secure it in
And
place.
we got that off of the catheter, correct?
Correct,
Okay.
yes, the colored tubing at the end that connects to the saline port.
Yes.
That tells us exactly. So with
Perfect.
this one, it was 10 milliliters.
Okay.
So we'll make sure that's in there. We're also going to document how the patient did. And the patient seemed to tolerate it amazingly.
She did. She was laughing during it
Yeah,
too.
she
so
was such
she
a
was
trooper.
amazing.
We're also going to notate that we collected a urine specimen
Okay.
when we sent it out.
Mhm.
We're also going to the amount during the process that we got out that was in the bag, as well as the color, the clarity. I didn't notice any smell when we collected the specimen. Did you?
No, I didn't.
It seemed kind of
It
as
seemed-
normal.
Yeah.
So we're also going to document that, and as well as we're going to start her on an intake and output record, all the output.
Perfect.